Well, welcome everyone. Welcome to Friday's report out. It's great to see you all. Really pleased you could join us today. We've got, I guess, after what I think we can regard as something of a historic week with the commencement of vaccinations against COVID here in the Trust. With our partners across Leeds. It's been a great example of teamwork and collaboration. So we're delighted that we've got the team here to talk us through how they've used the Leeds Improvement Method to help support the planning, preparation and deployment of vaccines. So I'm really pleased to hand over to the team. I haven't, Jimmy, got a specified individual, but if I just say the team, I'm hoping one of you will pick up the baton. So over to you.
So I'll just start by giving a quick overview of what we were asked to deliver over the last couple of weeks. I'm sure a lot of people will understand it's been a fairly manic couple of weeks, because of the fact that we have been asked, and rightly so, to roll out the delivery of vaccines as quickly as possible to derive the greatest benefit we can from having these available to us. The planning for this has changed, and the assumptions made changed until a fairly late point in time. So the actual definition of the project that we've been asked to deliver wasn't confirmed until the 30th of November, which was to establish a hub in a hospital setting that was capable of delivering an initial consignment of about 1,000 doses of the vaccine in a time frame of 5 days or less, which is the time that's available to the team from the point of taking the vaccine out of the freezer until its expiration. However, we knew that wasn't going to be a one-off. Clearly, this vaccination programme is going to roll on for some months. And so we recognised that there would be a need to try and scale up the delivery programme in the coming weeks and months. We've been given a pod model through national guidance, but that was a template that was given as guidance on the assumption that as we developed a better understanding of how things worked, we would develop that and clarify our own internal processes. The fact that we only had 1 week from that point of confirmation of the project to an assumed start date, which was the 1st of December, we knew that we would be planning this and problem solving as we went along. You know, we were starting the rollout of structures within the buildings that we were using, knowing that they would need to change as we developed. But very early on, I think on the 30th of November, we recognised that we wanted the KPO to be involved because there would be so much opportunity to learn from what we were doing in the first week that would inform how this programme could be delivered both in Leeds and potentially to share that learning regionally and nationally. And we also knew that if we could take opportunities to eliminate waste from this process, we would better be able to do what we're hoping to do, to deliver as much vaccination as possible to as many people as possible, as quickly as possible. And so I'm going to hand over to the team now to take you through what's happened over the course of the last week.
Hi, my name is Natasha. I'm a KPO specialist trainee within the KPO team, and I had my favourite job this week of mapping the patient's journey. And I did that using one of the Leeds Improvement Method tools. We have the standard worksheet. So I'm going to talk you through the journey here at Leeds. When a patient arrives, they enter the reception. They will then exchange a little bit of information with the receptionist about their follow-up appointments and checking of identification. They'll then move on to talk to a nurse or another operator who will ask some further questions, making sure that they are fit to have their vaccination today, giving them some further information about the vaccinations. They will then move to the second floor, either using the lift or the stairs, where we have marshals who are directing patients into the best possible side to manage the flow. They will then sit in the consent station where they read their consent pack, have a little bit of time to take it in, and fill in some information that we need regarding their GP, so we can let GPs know that patients have had these vaccinations. They then have an opportunity to speak to a consultant or a doctor, ask any questions that they might have about the vaccination, talk about any medications or side effects that they might have. Once they're happy with that and it's been consented, they will then move on to the vaccination pod and receive their vaccination. After that, as per the government guidelines, they will move to a recovery area where they will sit for 15 minutes, have the chance to have a glass of water, a cup of tea, before they then move on to be escorted out by security. What this looks like in practice here at Leeds is on the next slide. We have some pictures of our reception area, our consent pods, the vaccination hubs, and the area where patients will sit to recover. All of these set out at 2-metre distances to keep everybody as safe as we possibly can. I'm going to now move you on to Matt, who can talk us through the value stream map that we created using our observations.
Good afternoon, everybody. Hello, my name is Matthew Spence. I am a pharmacy technician by background. I'm also a member of the KPO team and the pharmacy department's continuous improvement specialist. So here we have the value stream map, and I appreciate that it's very small on the screen, so you will probably not be able to read that. And I'll take you through what the value stream map says. A value stream map is a bit like a process map, except that it has observation timings in there, so we're directly observing the process so we can capture timings. And then we also have these Kaizen bursts, which are these nice clouds at the top, which are opportunities for improvement, which are identified through the observation where we see some waste in the process. So as Natasha has kind of already taken you through the process, as she's identified, what we see is that there's around 6 steps in the process, and that can vary depending on the staff available. The overall lead time taken from when a patient walks in through the front door and then leaves, as Natasha has alluded to, by security, is currently 39 minutes and 4 seconds. When we first did these timings, it was 44 minutes on Tuesday. So we've already started to see an improvement in the process, and we'll touch upon these little bits of improvement as we go on through the presentation. So what we see is normally at step 1, the initial check reception person will clarify some details, and this has around a lead time of 2 minutes currently. The next step is then moved on to a nurse who will ask further questions and provide information packs, including their consent form. And this has a lead time of at the moment of 1 minute. What we do see is in variation at this step. This step can be done by one person in late in the evening or in the morning. It will very much depend on whether a nurse is available to do that second step. So you kind of see step 1 and 2 can be combined. And that's part of the variation in the process. As Natasha has said, then the patient walks up the stairs and then is marshaled into one of 2 rooms where the pods are set up. Before that, they go in to complete their consent form. So we've identified 2 steps to the consent form. First is reading through the information and completing the consent form, filling it out with a pen. And the lead time for that currently is 5 minutes 26 seconds. There is lots of opportunity in at this step with possible duplication from the questions that are asked at the front desk to at the consent station. Then the medic will then, or consultant pharmacist will then come and complete the consent form with them. The patient will have the opportunity to ask any questions, and the current lead time for this is 3 minutes 33. The next step is then the patient is ushered into the vaccination pod, which we have not directly observed at the moment, but we do know there is a lead time of 3 minutes 53 seconds. So that's the actual time to receive the vaccination. After this, the patient is ushered into a current observation area, which wasn't part of the process on Tuesday, but this was a change implemented or introduced on Wednesday. So we had to observe patients for 15 minutes from this period. What we have seen is that our current lead time for this step or process cycle time is 17 minutes for this step in the process, even though there's 15 minutes of wait time. What you can see on the screen is lots of Kaizen bursts, so there's lots of opportunity for improvement. Next slide, please. And here are some of the improvements already. So we've already started to PDSA. So we've talked about the observation period being 17 minutes. So you can see on the top right-hand corner, we've introduced wipeable screens where nurses can write on the time that the patient arrives to sit down into their observation period and the time that they can leave. The nurses had already done this and started writing it on pieces of paper. You can see that on the picture next to them. So it's very much a great piece of quality improvement in action, and this has actually reduced the lead time of this step, this cycle time, to 15 minutes, which is not fully reflected in the overall lead time yet because we haven't observed that enough. We've also seen in the bottom left-hand corner the implementation of visual controls. So one of the feedbacks from the nurses was around, we're not exactly certain who's doing what role. So we've devised, not fully implemented, so the idea of ID badges, but what the nurses team did last night, which is fantastic. They've started to write their names on who's doing the vaccination. So as the medic, the consultant pharmacist, or the nurses ushering them into the pod, they are already introducing them as you're going to go see Nurse John as shown on the picture. I will now hand over to, I believe, Alison or Nicola. Next slide, please.
I can't see Alison on the call, so I'll talk us through this one, Alison, unless you jump in. So as everybody's alluded to, it's been an awful lot of work this week and it's been done very, very quickly. So you can imagine sometimes it feels a bit chaotic to those involved. What has been absolutely amazing is that hasn't been the experience of the patients at all. What the patients have fed back so far is that it's been running really smoothly, it's well organised, you got it right today, they'd like it closer to home. They have said that it would be better if they don't have to wait outside, and I think that does reflect that the Thackeray probably wasn't the most ideal environment to set this up in, but obviously we were constrained by a number of factors, including the time in which we had to find somewhere. So I just think the comments that we've had so far are a really big clap on the back to everybody involved, that we're providing a good patient experience, even in very short timeframes and testing circumstances. So thanks to everybody. Next slide, please.
Thanks, Nicola. Sorry, can I just add that we've had some emails as well. Hello, my name's Sophie, part of the KPO team as well. And I wanted to add that we've had hot off the press. A doctor has sent some thanks to the team and has said that he's had his first vaccine yesterday, and he wants to congratulate the team on how organised and the service was delivered really well, so well done. And then we've had from a care home manager a thought out email that says the service ran so smoothly from receiving the email to getting a confirmation, plus how well organised the process was at the centre. And they've said it's not easy adapting a building to be able to manage the flow of people safely and distanced as well. 8 staff from their care home attended, and they've all had that same experience. So thank you.
Thanks, Sophie. So this next slide is about the staff experience, because obviously that's equally important. We're asking staff currently to volunteer to provide sessions within the vaccination centre. And as I said before, to those of us who've set it up over the last 2 weeks, it has felt incredibly fast paced. But actually, I think it's worked really well if we look at the staff feedback. So there's one issue around somebody didn't get an email confirmation, had to ring up to confirm their shift. But actually, there's an awful lot of positive feedback as well as that piece of learning that we can take away. So one member of staff said very touchingly, "This is the happiest day I've had since the start of the epidemic." I think there's something really amazing around the teamwork within the vaccination centre as well. Many have said they can feel the camaraderie within the clinic, that it's quite a historical moment and they're emotional about being involved in the team delivering this. And another member of staff said to us last night that, you know, they felt they were part of history. So it really is quite a special feeling within the vaccination centre, which is really lovely, given all the work everybody's put into setting it up. Next slide, please.
Hello, my name's Helen Raleigh. I'm the interim KPO lead. So I'm just going to talk you through some of the next steps. I think, you know, the Thackeray building's been mentioned. There's not a lot of space up there, and it's one of the things that we've really recognised this week. And so, you know, key things that we really want to pick up over the next coming week is around principles around the 5S, so that we can look at both the storage areas as well as the setup within the pods, to make sure that the staff have got the right levels of equipment, that equipment's in the right place, and so that we can really start to set them up for success in their workplace, as well as understand the inventory so that we don't waste inventory and we don't overstock in the area. And also, as the team have already reflected, recognising the number of staff that have already contributed to the learning and the improvements that have been identified, we are really keen to make sure that we've got a really robust system to ensure that we capture that real-time feedback from staff working, as well as patients coming through the process, and that we also have a system to recognise feedback to those staff that have contributed, recognising that the rota staff may work 1 or 2 shifts and then have a break. And so, you know, if they don't get direct feedback on the day, that we can make sure that we feed back to them at a convenient point so that they understand they were listened to and that their actions were taken forward. We're really keen, obviously, to ensure for their well-being and the morale of the team, to make sure that the environment really does support their needs as best as we can deliver it. And then introducing, you know, as Tim alluded to at the beginning, this week's been very much let's get up and get going. But appreciating this is going to be a service that needs to move towards normal business. And so there are a few things this week that we'd set up, huddles and handover between those 4-hour shift times. We really want to ensure that we understand the purpose of that huddle and that handover time, so that we can set up that process to be really slick and it serve the purpose that's needed, both by staff exiting shifts but by staff coming onto shifts as well. And this is really about maintaining the safety and quality of service, and it goes back to understanding that real-time feedback. We will continually work and do observations over the next few weeks with the team to ensure that we understand that demand capacity. As the team alluded to, the process is set up in a way that was guided by a template. And so we really want to take the learning that we are getting all the time now, every day, to be able to understand where we may have bottlenecks in that system and what we can do to then remove those so that patients and staff can keep flowing through that process swiftly. And then lastly, one of the things that we will really start to work on beginning of next week is about, you know, developing standard work. And so we've recognised the number of staff that have come to work in the area this week, and we recognise the rotas for the coming weeks, and it's brilliant to see such a collaboration of staff come together, but they don't get long to get going. And so one of the things that will be really helpful to set them up for success is some really good standard work for the job role that they're allocated to, and also for job roles that we know they cover during break times. And so ensuring that staff really understand their remit whilst they're working there will really help support the overall flow of the system. And again, going back to really maintaining that safety and quality of service. Next slide, please.
Hello, my name is Nicola Nicholson. I'm the General Manager for Medicines Management and Pharmacy. So as everybody's just spoken about, we've learned an awful lot this week. Tim mentioned earlier that there was a national guidance, but that wasn't based on practical experience, obviously, as the vaccine wasn't available at the time. And it wasn't certainly based on practical experience in a Victorian museum. So we've learned a lot about how we can make this work in the Thackeray. One of the things we were hesitant about when we were looking at this last week is the amount of wastage we might have of the vaccine. So the vaccine comes in a multi-use vial and needs to be reconstituted. The liquid reconstituting is actually very viscous. So we were concerned that we may see some wastage and not be able to get all 5 doses out of the vial. Rather than book people into a vaccine and then have to disappoint them, we built into a 10% wastage into our plans. What we found this week is actually we're not seeing any wastage. So that's absolutely fantastic. But it does mean that this week we have some available slots at short notice. So we can learn from that next week and build in the lack of wastage into our plans. The other thing we found this week is a DNA rate a little bit higher than we were expecting. So we are now building into the afternoon of next week's Friday some reserve slots so that we can plan for the DNA rate and book people in through the week as DNAs occur. So that feels a lot more comfortable. The staffing rota and the effect on flow is something else that we've learned about. One, when they set up the rotas, we built them on a 4-hour rota for staff. And due to breaks and shift handovers, we found that does affect flow quite a bit, especially as everybody this week has been new members of staff. So as the week's gone on, we've seen a much more slick handover process, so that's very beneficial. The staff setup and support, yes. So we had what felt on Sunday night like a palatial staff room in the Thackeray Museum. However, as the number of staff that 3 pods require have come through, it now feels, as Helen has just said, that we're quite tight on space and changing facilities aren't as good as they could be. So we've learned about that and we're looking at what else we can do to provide that environment for staff and support. One of the main things we've learned this week is that biscuit consumption is significantly higher than we were expecting. And that sugar is the main driver of the vaccination programme. So we are then building that into our future plans as well. Another lesson that we've learned on a more serious note is around the 15-minute waiting after you've had your vaccine. The guidance changed around that on Wednesday, I think it was. So we are now slightly constrained for space post-vaccination, which the KPO team are being amazing at helping us work out how we can fit in the slot timings we need and have enough space for people to wait 15 minutes while they're observed after their vaccine. So a big thank you to you there. Next slide, please. Oh, and then just a massive, huge, big congratulations to everybody who's been involved in this. We've set it up in a week. A week ago today, we got the keys for the Thackeray and it was a museum. And by the end of tomorrow, we will have vaccinated the best part of 1,000 people with a vaccine that we've never seen before, using a clinical process that we haven't done for a decade. And it's just an enormous thank you to the army of people that have supported that getting off the ground and bearing with us as we learned as we've gone along. So thank you to everybody.
Fantastic. What a great presentation. That's really inspiring. I'm sure we all feel incredibly excited by this. And also, I think what's really telling is how we've used the Leeds improvement method to really drive the planning and the implementation of this. It was fantastic to see all of you involved in that way, and great, Helen, Nicola, all of you, really, just the way in which this has been delivered and done. And I think, as Tim said at the start, responding to the kind of changes and the way we've had to operate it. I was really struck as well by the comments from those who benefited, as well as our own teams. So, you know, really great work. And of course, this is only the start, isn't it? We'll soon see this roll out further, and I'm sure there's many lessons and you know, the advice and support we can offer to our colleagues in primary care and other hubs on this. And of course, this was an effort across all organisations in Leeds, not just Leeds Teaching Hospitals. It involved colleagues from community, mental health, across the NHS, which is great. So really, really well done. And I think the words historic are not exaggerated in this case. So terrific. Very much. Going to now just perhaps hold for questions when we come to the end of the report out, because I do have a very important item and congratulations to give to Una, who is well known to us. Una Laverty, our lead clinician in clinical sciences and supply services in medicines management and pharmacy. Una, I can see you, you're there. I'm really, really pleased to virtually kind of award you your certification in advanced lean training. That is no small achievement. It really does take a lot of work, and I know how committed you've been to using the method in the many, many projects and tasks and major challenges that you've been involved in for us. So really, really well done. And I'll just hand to you to perhaps just give us a bit of a sense of how it's been and what you've learned.
Okay, thank you. So there's my slide. So I was delighted to receive an email from Helen back in June to say I'd passed and that I'd shown perseverance. She'll understand what I mean by that. I've done quite a bit of reflection on my improvement journey to date. And to be honest, the support and the influences I've had from within pharmacy and the KPO team. I started off with using a lot of what we did in the ALT to begin our #HelpHarry story, which some of you may be aware of. But when I reflect back, I keep going back to this Toyota slide, which is fundamental for me as it brings it all home. The importance of our people, how we support them, how we nurture them and develop them. And this is underpinned by a culture of respectful behaviours and continuous improvement, which I think is key to all that we do. Next slide, please. So in pharmacy, as I say, I'm fortunate to work with a hugely energetic and supportive team. And together we've been trying to build up a culture of improvement through respectful behaviours being our foundation. So just to give you a couple of examples of what we do, we have a monthly quality improvement group, and we begin each of those meetings with a reflection on respectful behaviour and ask our group members to share how they have used respectful behaviours to improve things for our patients, for our staff, or on our processes. And what we hear at that monthly meeting about respectful behaviours and how they're using it is truly inspiring. To put a little bit more context into some of the tools, I do have my favourite tools, and I do like shoes. So I'll go for the rocks in their shoes is one of my favourite tools that I learned as part of the ALT, and I use it all the time. I facilitated a conversation post-Surge 1 with a group of clinical pharmacists and asked them what the rocks in their shoes were. It was a hugely engaging meeting, and connecting with them was really important. The conversation then kicked off about how could we improve the supply of medicines, and that resulted in the work that we've been doing on J91, which I know we've had a report out on. And it's great to see that from a conversation about rocks in people's shoes that we went up, we truly listened. We listened to understand, and we've done a number of PDSAs, and we've improved the process time for nurse ordering by 91% and for pharmacy by 41%, which I know has been shared at a previous report out. And the good news is that we're spreading this. It's already gone to 92, and I'm pleased to say that we're starting on 83 this week. So that's great. So I've been known to enthuse a bit about Leeds Improvement Method, and I continually try to remember to meet people where they are at. We're all at different stages in our improvement journey, and I think that is hugely important to enable us to set people up for success. And secondly, I think my reflection is that we must always put the patient at the centre of the decisions, and I continue to try and do that. So at this point, I kind of just want to say that I am continuing to use what I learned in ALT. You might have heard me going on around cracking discharge and how can we improve things with the EDAN, and certainly bringing a lot of the tools that I learned as part of ALT into that. So at this point, I would just like to say a thank you to Matt and to Catherine Hughes in pharmacy for their support, and obviously to Helen and the KPO team. So thank you.
Thank you very much, Una. That's terrific. Really good. And you can see from some of the examples you've given just what a difference this approach makes. And I know myself from the conversations that we've had and the work that I know you've been doing on discharge, just how crucial that is during this time when we've been going through some of the peak admissions with COVID, to make sure that our discharge is as good as it can be and how we manage that and improve that. And your work's been central to that. So thank you very much. We've got some questions now. So please stick your hand up, ask away in relation to what you've heard from the vaccine team, which has been fantastic, and also the great work that Una's been doing to achieve her advanced lean training certification. So let's open that up.
Thanks, Julie. Not a question as much as just something that I didn't say at the outset, and just wanted to build on some of the comments that other people have said. Throughout the setup of the vaccination centre, respectful behaviours, Leeds Way values have been absolutely apparent. The collaboration between the different teams, both within LTHT, but we've worked with partners from Leeds Community Health and Leeds York Partnership Foundation Trust. And they have worked collaboratively under an enormous amount of pressure, have maintained a patient-centred, fair approach with each other, but also, worked accountably for themselves. People have delivered on what they've said they're going to do, and have done that without constantly asking for permission. And so, people have been empowered to get on and do this. So it's been really an inspiration about how well people have worked together under an enormous amount of pressure.
Yeah, well said, Tim. Yeah, absolutely right. And I think your point's well made about the pressure that everyone is under in these circumstances. I don't think this year really had a moment without it. It's just been so intense, but to sustain the quality of those interactions and respectful behaviours under such pressure is fantastic. So really good that you've underlined that. Any other questions or comments? Andy?
Thanks, Julian. Hi, everyone. For those of you that don't know me, I'm Andy Alted. I'm the Chief Pharmacist, and I've been part of the team who've been pulling together the vaccine programme. And I'm really sorry, I was just over at the centre helping to induct some of the anaesthetists who were coming on shift. So I just managed to catch the last couple of slides. But I wanted just to a comment really, and I think somebody new into the organisation, relatively new, coming in March, and I've been learning about the Leeds improvement methods and Leeds Way values. And what Tim has said there is absolutely spot on. I mean, this has been a project which has had a really significant impact in terms of the colleagues who've been vaccinated, but the methods which we've used, which Nicola no doubt will have taught you through and which Tim has alluded to, have been really fundamental to enable us to deliver a project in such a short period of time. And those values which Tim has talked about, as you can imagine, when you're working at that pace and the number of policy changes which are coming from the centre, and you're having to be flexible and change models, and to the extent where you get advice and guidance coming in at 5:30 on a Friday night that you then have to implement, is hugely challenging, but a massive kind of thanks to everybody who's been involved in the project to deliver what it has delivered, and it's only through those ways of working can you deliver such a complex project in such a short time. And as you will have seen, the feedback from the staff who have been working in the centre and the staff who've been through has been really positive, and that's really gratifying when you're working your socks off and you got your head down. And I said to the team at the beginning of the week, take a moment to kind of just reflect about how important this is and what you've achieved, and this is a really good way of embedding that as well. So thank you to everybody who's been involved.
Thanks, Andy. Really well said. And I mean, I think the way the team has come together and the way that you've all led this over the course of the last few days has been absolutely fantastic. And I know dealing with challenges, dealing with the unexpected, managing all of those things really well, sort of truly impressive. And it's great to hear you as well as a relative, although I think it feels to me like you've been here a long time, given how much you've had to sort of go through, lead and manage. But as a relative newcomer to the trust, it's really good to hear that. But you're definitely one of our own now, Andy, having been through what you've been through, and all of the what you've managed to pull off is fantastic. But it's great that I think particularly, you know, that the whole team, but also thinking about medicines management and pharmacy services, all of you are really great examples of the way we use the Leeds improvement method and so on to improve and drive change, as indeed are, you know, all of our CSUs. But it's nice to have Una on today as well to sort of make some connections across, because I know a lot's fallen to the team in medicines management, but you guys have done a fabulous job along with everyone across the trust. So thank you for that, Andy. Well, that has been, I would say, a truly inspiring report out. And can I just put on record my thanks to all of you and the KPO team, who I think are fantastic, or the way that you've all really moved to work alongside everyone involved in the vaccination programme to apply the Leeds improvement method. I think it's a measure of whether or not an improvement method is embedded when we're given such a high priority task and challenge as this, probably one of the most important challenges we've ever had in the NHS, that we've turned to our method to help us drive and support it. And I think that is, you know, huge testimony to what we've embedded around the Leeds improvement method, and tells you an awful lot about how we approach those challenges. And thank you to all of you who've been involved in making this happen. It's been a genuinely collaborative effort, and I think Tim and Andy have really articulated that in the way that they've described it. And Una, really well done. So pleased that you've got to that level, and much more to come, I'm sure, in terms of what we can do in some of the work you've been doing. But what a great report out, everyone. Thank you for joining. Please pass this on. We have recorded this, so I would like us to perhaps show this to other colleagues, just so they've got a sense of what's gone into this. And really great to share this at the end of another momentous week. Thanks very much, everyone. That's the end of Report Out. See you next time.